Billions of people just living out their lives, oblivious.
Unfortunately, no one can be told what the Matrix is. You have to see it for yourself.
There's something wrong. There's something wrong. You don't know what it is. You don't know what it's there. Like a splinter, driving you mad,
Bring the ship up to broadcast depth. We're going in. Taking Neo to see her.
See who? The Oracle.
Howdy, folks. We're happy you could join us. I'm James Sangster, founder of Houston Ghost Research and author of Help, I'm Haunted. We've got a new format today we're going to try out for our topic, which is possession syndrome. So the new format is a roundtable discussion where we gather together several experts to discuss the topic at hand and go at it from a couple of different perspectives. Our guests for today are Stephen Diamond, PhD. He's a licensed clinical forensic psychologist practicing in Los Angeles and a former pupil and protege of existential analyst Robert Rollo May, or Dr. Rollo May. And he's currently professor at La Jolla Marymount University in Los Angeles, in addition to specializing in providing existential and depth I'm going to stumble on this, and depth psychologically oriented psychotherapy to adult patients for close to 40 years. Dr. Diamond is a former member of the forensic panel for Santa Clara County Superior Court and approved for the panel of psychiatrists and psychologists for the Superior Court of Los Angeles County Criminal Division, in which also conducts forensic evaluations, and he serves as an expert witness in various criminal cases. He's also the author of Anger, Madness, and Diamonic, I believe I pronounced that correctly, the psychological genesis of violence, evil, and creativity. So he wrote a blog entry on psychologytoday.com titled Giving the Devil His Due, Exorcism, Psychotherapy, and the Possession Syndrome. That initially caught my attention, and we decided to pull together a panel of folks and have a discussion. And I wanted Dr. Diamond to be the cornerstone of that discussion, to try to look at the situation from a clinical perspective. Links to his book and his article will be in the show notes. We've also got joining us today former guests of the podcast, psychic medium Debi Chestnut. She's a prolific author of about 10 books. She's also been involved in paranormal investigation for over 20 years and recently published a book, among many, titled How to Clear Your Home, which she joined us to talk about in depth some of the stories she shared there. She's also the author of Is Your House Haunted? Ghosts of Anchor Bay, So You Want to Be a Ghost Hunter, and others. Finally, joining us yet again, we're really privileged to have her perspective in this discussion, especially, is Occulta. She runs a discussion forum named Satan and Sons, SUNS.com, and has been working with demons and embracing the darker energies her whole life. She enjoys teaching and guiding others who are drawn to walk the dark path, and coaches them on how they can stay balanced and grounded with walking that path. So, along with Keith, our regular co-host, that's sort of our outline in the show today. I'm really excited about where this is going to go, and we're just going to kind of let the discussion flow a little dynamically, and I'll edit here and there as needed, as we always do. So don't forget, our show sponsor is BlueRoseAlchemy.com. That's my own personal business. Lots of cool stuff up there. Ormus ritual incense that we use in our own practice for exorcism and house cleansing. Really awesome 5-part sage sticks that are ritually blessed. Nothing like it on the market. Definitely check that stuff out. And I've got an ever-expanding line of stone medicine jewelry with actual gemstones, amethyst, moonstone, moss agate, one of my personal stones. And I'm about to come out with a line of moonstone, blue tiger's eye, and seraphonite, which is it's typically, hence the name seraphonite, typically associated with angelic work, which is something I'm deeply involved in. And definitely check out the website and subscribe if you're interested in seeing some of the new designs that are going to be coming out. We'll post stuff up there, and I'll update you guys on the blog. But enough about that. Let's jump into the discussion and see where we go. And again, thanks for signing in, listening to us, and don't forget to check out the show notes. And special thank you to Dr. Diamond for sitting in and sharing his expertise and his wisdom. I definitely found it very interesting. This is such a broad topic. I really wasn't quite sure how we wanted to dissect this discussion, but as we always do, I kind of really wanted to approach it casually and just let the discussion sort of progress from there. I think I'd like to start with Dr. Diamond. Can you give us, from an academic perspective, what does academia think, and what's their perspective on possession syndrome?
I don't know that there is one particular academic position on it. Again, I'm a clinician more than an academician, so I come at the subject from a clinical perspective. In other words, I've been practicing for 40 years now, and so I come at it, at least in part, based on my own clinical experience dealing with people. I mean, academically and scholarly, there are a lot of different ways of thinking about possession. But, the reality is that in academia, there isn't very much attention paid to that phenomenon. People don't care.
Are they typically classified as schizophrenia, or people who hear voices, that sort of thing? How would somebody registering say typical haunting phenomenon is precognition, and or possession phenomenon is precognition, hearing voices, speaking in non-human voices, that sort of thing? Right.
Traditionally in mainstream psychiatry and psychology, those sorts of symptoms, if you will, or phenomena, would be considered a form of psychopathology, and would be seen as being symptomatic of, yes, some kind of a mental illness or mental disorder, such as schizophrenia, or in some cases maybe bipolar disorder, in full-blown manic episodes, other types of psychotic disturbances, etc., delusional disorders. So most of those kinds of symptoms tend to be pathologized and basically seen as symptoms of some kind of mental disorder.
Okay. Hey, Deb, can you pull your mic away from your face? Okay.
Yeah, I did.
We can still hear you just a little bit. I'll go edit that out. So, Dr. Diamond, once somebody is diagnosed with some sort of clinical pathology, what's the typical treatment regime or approach for something like that?
Well, again, it would be helpful to me, if we can be as concrete and specific as possible. So when we're talking about, let's say, particular phenomena or symptoms, let's sort of specify what we're talking about so I can speak to it intelligently.
I'm sorry. No, I'm sorry. Maybe it would help if we start out with the psychological definition of possession syndrome from your point of view.
I'd be happy to give you my definition.
That'd be great.
Okay, I can give you my definition. My take on the subject is that what I call the possession syndrome, is very real. In other words, it is an actual phenomenon. It is something that has been going on for thousands of years, maybe tens of thousands of years. It's something I've seen in my clinical work. So I don't deny the reality of the syndrome itself and its phenomena, its various kinds of manifestations and expressions. The only real question for me is how we explain it. Again, I say that the phenomenon has been occurring for thousands of years. So let's say 500 years ago, when someone was suffering from what I call a possession syndrome, it was perceived to be and explained and also treated as a case of demonic possession. In other words, what was happening was that the person their body and or brain had been invaded by some entity, some demon, and that was the source of their symptomatology, if you will. Okay? So 500 years ago, that's how it was understood. That's how the syndrome itself was understood. Now, as was mentioned earlier, for the past, let's say, a couple of hundred years, or maybe 150 years, with psychiatry and psychology coming into development and prominence, now when we see the possession syndrome, today we tend to, in my field anyway, we tend to explain it, again, as some kind of a mental disorder, a mental illness, and moreover, it tends to be, in mainstream psychiatry, it tends to be perceived or understood as some kind of neurobiological problem, some kind of a biochemical imbalance or broken brain, as it's called in schizophrenia. I don't. Now, my definition differs from that. I see the syndrome as more of a psychological phenomenon, wherein certain repressed or denied aspects or unconscious aspects of the psyche and of the personality take over. They take over, they take possession of the whole person, and they drive the person often into destructive behavior or violent behavior, evil behavior, we might say in some cases. So I see it more as a psychological phenomenon than a neurobiological one, although those two things are impossible to really separate since they're integrally related.
So how does that compare with, say, multiple personalities or split personalities or something along those lines? That sounds like a very similar definition.
It is very similar. Now, what used to be called multiple personality disorder is now officially called dissociative identity disorder, or DID. And that is actually, I think, the best example of the possession syndrome. Because what happens in DID is that one aspect of the personality, and it's usually a dissociated aspect or a denied aspect or a repressed aspect, actually takes over the whole person. So much so that in some cases the individual has amnesia episode, doesn't remember what happened, but is basically possessed by this other part of themselves, if you will, and is will behave in different ways. I mean, the phenomenon is so powerful that there have been some studies in DID that demonstrate that in each different personality, and in some cases there can be hundreds, but typically there's maybe 3 or 4, but there are studies that have been done that actually when each personality takes over, each personality can have a different need a different prescription for eyeglass lenses, have different IQs, and so on and so forth.
So physiological changes occur.
Well, seemingly physiological. Seemingly physiological, but impossible to separate that from psychological.
I've heard someone mention that even eye color changes. Now, that would be a little bit different if that's actually true. Have you ever heard of actual eye color?
I have not heard that. But I have heard some of the other ones I mentioned.
So has it been your experience with your patients suffering from the possession syndrome? Do they believe they're possessed by a demon, or do they not understand what exactly is happening with them?
No, that's a great question, because really that goes to the crux of the matter for me.
Right.
Again, I have to just restate that, and take responsibility for the fact that I come at this from a particular point of view. I come at this as a psychologist. All right. So I come at this with a psychological perspective, and that's just one perspective. But here's the issue. Someone has this experience, the experience of the possession syndrome, but they don't necessarily have that name for it. Typically they don't know what the hell is going on.
Right.
They know something is happening to them, but they really don't know what. And in fact, especially in cases of psychosis, for example, the onset of psychosis, or the onset of what we call a psychotic episode today, there is massive confusion in the person's mind, and there is total disorientation as to what is up and what is down, where reality lies, and to what is going on. So typically the person has no idea what's going on with them, but is profoundly affected. So then the issue is, we as human beings, we tend to need meaning. We are meaning-making creatures.
Right.
Viktor Frankl, the existential analyst, talked about the will to meaning as being just, innate. So then comes the process of trying to make some sort of sense of the experience, some sort of sense of this inner turmoil and this phenomenon and these symptoms. And, there are various ways to do that. So again, the traditional way is to explain it as the work of the devil or of demons, some kinds of invading entities, and some people will seize on that explanation of their experience. Maybe because they grew up in the church, they're familiar with that. They've seen The Exorcist, whatever it is. Mm-hmm. But that's a very common way of trying to understand the experience. And in any kind of psychiatric hospital, for example, on any given day, when you see patients who are in the throes of what we call an acute psychotic episode, they believe they are possessed by the devil or demons, and in some cases they believe they are the devil. I mean, this is a very common experience and explanation that patients, let's say in a psychiatric hospital, will seize upon to try and make some sense of their experience. Now, of course, the doctors will tell them, no, that's not what's happening. What's happening is your brain is broken. You see, that's another explanation.
Right. So then let's assume then that we have a patient who, in their mind, believes they're possessed, even though, it could be classified as a possession syndrome.
Okay.
So since that's their perception of reality, I was reading an article in Psychology Today about the possession syndrome, and they were saying in some cases that having someone come in and perform an exorcism actually gave these patients some type of relief from their symptoms. So would that be almost like a placebo effect for them?
Yeah, I mean, that may have been my article that you read, because
That's what I was thinking.
I write for Psychology Today.
Oh, okay, maybe it was.
Okay, and so yes, yes, when exorcism has been around as a remedy for the possession syndrome. Exorcism has been around in some form or another, again, for thousands of years. So if somebody is convinced that is the root of their problems, the source of their problems or symptoms, then, psychologically speaking, yes, actually undergoing exorcism can be effective, at least temporarily effective, I would say, because they do believe in it. So yes, it would be, you could attribute it to the placebo effect because they believe that it will help them.
Right, so then it all goes back to their perception of reality.
Very much so.
Okay.
Very much so.
It's interesting.
So, Dr. Diamond, can you give us, obviously without any patient information, can you give us any examples of some of the more peculiar manifestations you've witnessed in your practice?
Oh, well, I think some of the best examples I could give you would be from my work in the emergency psychiatric service at County Hospital. Because there, people would be brought into us in these very acute states of possession, if you will. And often they would be brought in by the police or maybe by the EMTs, and they would be handcuffed, or they would be on a gurney, sort of tied down on a gurney, because they were just completely out of control, and often in a state of rage.
Right.
Now, sometimes it would take 6 or 8 police officers to hold down a 5-foot female in this state. So there you have that sort of super strength, that kind of, power that comes from adrenaline and whatever else. They would speak in tongues, maybe making up their own language. We didn't have time to research whether it was an actual language or not, but it could have been.
Right.
They would spit. Sometimes there would be projectile vomiting.
That's got to be fun.
Well, this is what believe it or not, this is what psychiatry deals with on a daily basis. You see, but it's precisely what the exorcists used to deal with.
Right.
On a daily basis.
Well, you just said something about them speaking languages. Did you say they can sometimes speak a language that, as a person who didn't have the syndrome, they didn't even know? Has that ever happened?
I believe that, yes. I think that has, in the, as you know, the Catholic Church in the has certain requirements before they will allow an exorcism to be performed. And one of the requirements is that exactly that the person is speaking in a language that they didn't know, but that is actually another language.
It's very interesting.
And that's a very distinctly different phenomenon from glossolalia, which is speaking in tongues. That's exhibited in many different cultures and many different religions. But if it's a recognized formal language, the Catholic Church recognizes that as one of the potential symptoms of possession.
Yes, they do, and they have a certain fairly high standard now, and part of that is a complete psychological evaluation. Because in their minds, because they want to rule out a psychiatric or psychological causation before they. But I think that's an error. That's a big error on their part. But because I don't think you can make that separation.
Yeah, they're in very sticky territory when they try to do that. It's I've never really quite understood that approach.
Well, they're trying to be modern. They're trying to be with it. They're trying to show that they're sophisticated scientifically.
Yeah, but from my own approach to dealing with this sort of phenomenon with clients that I've worked with from a spiritual perspective, I consider it a little unethical to deal with someone who thinks they may be possessed without access to a medium, someone who can actually identify whether there's one consciousness or two consciousnesses or three or multiple or whatever is going on. Because if you have that ability and you can perceive that level of reality, you can tell whether it's just one person sitting across from you or whether there's three entities in the chair across from you. That's really the clear-cut definition of possession in my mind, whether you're dealing with multiple consciousnesses or just one.
Right.
Now,
wouldn't that get a little tricky if, as the doctor said before, if they're suffering from dissociative identity disorder and there are actual physiological changes taking place as far as like IQ and other things
in the different personalities.
You're right. Wouldn't that? That could really trick up a medium. Being a medium myself, that could really trick you up because you might sense however many personalities they have in that chair.
Yeah, that's a very good point. Kelta, you want to weigh in on that?
Well, one thing I always look at when I'm looking at the person is their energy field. One of the things I do is look at energies and their auras, and a lot of the times when there is an entity there, it doesn't even necessarily have to be an entity. It's just an energy that feels foreign. It feels violent. It feels destructive. It feels completely different and hostile, and a lot of the times it is embedded into deep layers of their aura. And I know that a lot of times it is a gray zone, because I was just thinking about the psychological element of it as well as the spiritual element of it, and there is sometimes gray areas where I honestly think you need both approaches with a person, because I have had people who have been they've clearly been a danger to themselves, and in those situations it's like, okay, yes, you need a medical element to step in and also assist with this.
Absolutely. Yeah.
Doctor, have you noticed? Oh, I'm sorry. Go ahead.
Let me just say, I just before I forget, I just want, I don't know who just made this point, but it's an excellent point. This differentiation between an entity and an energy, mm-hmm. I think this is very important and useful. Because to me, there's a huge difference between thinking of the possession phenomenon as being caused by some sort of external objective entity versus some kind of energy. whether that's internal or external. It's that would be hard to distinguish sometimes, but I think that's a useful distinction.
Now, in your patients, do you know if they have had any tests done to see if there's any chemical imbalance in their brain when they're going through the possession syndrome? And if so, has there been?
I don't, it would be a fascinating research study. Probably what would have to be done is mostly maybe using brain scans.
Right.
To see what kind of activity is going on in their brains while they're in that state. And I don't know that anything like that has been done. Some of it has been done with psychotic patients, and certainly there's some indications that different things are happening in their brain. And I suspect the same would be so with someone who, we see as being subject to the possession syndrome, if we even make a distinction between those two.
Deb, Kelsa, I wonder, as you guys are talking about this and sort of how to tell the difference between multiple personality or possession syndrome versus genuine spiritual possession, it occurs to me that in my own experience, I wonder if using a baseline of a woman who's pregnant might be beneficial. So in my experience, when I'm around someone who's in second to third trimester of pregnancy, that person exhibits even in early second, before they're really even showing, they feel like two personalities to me. They feel like two very distinct people contained in one bottle. Have you guys, do you guys experience that the same way? And I wonder if we couldn't use that as a baseline to try to figure that out, if multiple personalities would feel different than that.
I haven't felt that. I've never noticed that about a pregnant woman, personally. But as to Kelta's point, if there's a negative entity around, the energy is unmistakable.
Mm-hmm. It is.
It is completely different than anything else you feel. So that would probably be what I would personally rely on to distinguish between someone that might have an entity attached to them or suffering from dissociative identity disorder. I would have to rely on energy.
Mm-hmm. Yeah, and let me go back to this distinction between energy and entity again, because I think it's so important, if I may. In dissociative identity disorder, the subjective experience of it is exactly that, is that there is some kind of an entity that has taken me over. That is the subjective experience of it. Now, the problem with that is that then whatever it is that's coming up in the person is basically being projected. It's basically being denied. In other words, the person is saying, this doesn't belong to me. This energy is not my energy, you see? Right. Let's use anger, for example. This anger, which is an energy, this anger is not my energy that's coming up. So the reason I'm so angry and acting so angrily and violently is it's not me. It's not my feelings. It's not my energy. It's this entity's. See,
it sounds like denial of the shadow side. They're denying.
Exactly. Yeah. And so this is where it gets really messy, because psychologically then we are no longer taking any responsibility for this energy.
Right. I understand that. But like, to me personally, as a medium, a human spirit, a spirit or an entity that was once in human form has a different kind of energy from an entity that was never alive in human form, such as a demon or another type of energy. And that energy is very distinctive. So for me, if the person has 3, 4, 5 personalities, they're all going to feel like an entity that was once in human form to me. But if it's this entity, if there was an entity, if it was never in human form, that energy to me feels completely different. Like
Alien, would you say?
Yeah, it's I can tell the difference. Like I'll immediately get nauseous. Your adrenaline starts pumping. It's a thick, heavy, oppressive energy. It's distinctly different from any type of entity that was once alive in human form. Distinctly different, at least to me.
So, from an objective standpoint, though, how do you objectively know that maybe that's just a guy who's a tremendous asshole and he's really twisted mentally?
Because the energy will feel like a living being. No matter what their personality is, that energy is always going to have a baseline for me.
So it's a corporeal versus non-corporeal energy.
Yes.
When I know what I was talking about here, when there's certain entities around, I'll actually feel it in my stomach. It'll be like a queasy feeling in my stomach. And that to me is an indicator that there's something external that is influencing, because it's influencing my energies too, to the point that I'm having a physical response to it.
Exactly. Yes. I mean, I've had a very strong negative entity that was never alive in human form. Just their energy could bring me to my knees. And there is no other energy that has ever been able to do that.
So it's got a distinct vibration in and of itself.
Definitely. It has its own frequency. It's once you felt it, you'll recognize it instantly.
And it can affect you emotionally.
Yes. It can affect you physically, emotionally, definitely.
Yeah. Now, in my field, my area of specialty, psychotherapy being one of them, where we try to treat these issues and deal with these problems, we have a concept that we call countertransference. And what that means is that when you're working with somebody, with a patient or person, whether they're maybe experiencing a possession syndrome, you yourself, as the therapist, are subject to being influenced by their energy.
So that would be not unlike an exorcist performing an exorcism who's in danger of that demon leaving their victim and possessing them.
It is exactly akin to that.
I understand.
I wonder if that concept's really interesting. I wonder if the onset of those symptoms might be a little bit of a difference. So, for example, if I'm sitting down talking to a patient for hours or days or especially weeks, I would certainly develop a relationship with them and as I get to know their condition and their situation, as opposed to the much more immediate onset of those symptoms from a medium's perspective when they encounter somebody. They in many instances we use photographs for remote reading. You just look at the person without knowing their name or having any interaction with them, and you could get that same sort of reading. Dr. Diamond, would you say that from, say, a photograph reading, that sort of transference that you're talking about would be possible?
You mean looking at a photograph, or rather than being with the person?
Correct. Yeah, just studying a photograph of that person.
I think that's entirely possible to have a react. You know, I used to do a lot of work as a forensic psychologist, which means that I used to work for the criminal courts, doing evaluations of criminal defendants who, often were accused of having done heinous crimes.
Right.
And I often tell my students this, that sometimes I would have, before I would go and see this person, usually in jail, I would need to go and visit them in jail to do my evaluation. I would be sent all sorts of documentation, prior to going in there, about the case and about the person. And, it included all sorts of psychiatric history and rap sheets and all this kind of stuff. Sometimes it would include, color photographs of the crime scene, really horrific crime scenes. And, I would feel sometimes a real repulsion about even wanting to go and speak with this person and sit in a room with them for a couple of hours. And I think that's a very natural human response. I mean, I would get past it because that's my job. I'm a professional, but, and I would always go and do it. And as I've written about various places, it was always a humanizing experience. I mean, I can talk about that some more if you want, but I guess my point is, just from seeing the photograph and we're reading about an individual, sometimes you can get this kind of counter-transference.
Okay, I can definitely see that scenario. Akelta, from your perspective, could you maybe sum up a couple of things that clinicians, such as Dr. Diamond, might watch out for as far as symptoms or manifestations that might help them identify a legitimate haunting or a legitimate possession, as opposed to something that certainly may be a little more psychological in nature?
I have been thinking about this. My mom actually works in psychiatry, so I've been on psychiatric wards visiting her, and there is a really gray zone to how these things influence each other. Just because, I mean, a lot of people in psychiatric wards that I've seen, I can see either things around them or things on them, and a lot of them they're very tormented, very very damaged in a way individuals. And sometimes it's not so much, sometimes it's even their own energies that are working to create patterns in their head that are causing them to almost spiral downward into this horrific state. Sometimes when it comes to actual entities, though, one thing that it's hard to describe, but the cases that I've seen, it's almost like the person has just suddenly switched, and there is no sometimes there is no explanation. Sometimes it's just like, what's going on with this person? They were fine, and suddenly they are spiraling, and there is no medical explanation. There's no external regions. It's a shocking thing, and that's a situation where it's like, okay, maybe we should look to see if there's something external, something that's influencing them from a spiritual perspective. That's one thing I can think of. A lot of the times, though, I find that they tend to intertwine the psychiatrical element and the spiritual element. So it really can be on a case-by-case basis to look at the person.
Yeah, the scenario you mentioned does happen, where sometimes someone just, the bottom drops out and they become affected. They begin spiraling down, and for no apparent reason, externally or internally. Now, there usually are reasons in my experience, but they're they're more subtle sometimes, and they're not obvious. I just want to add that, or remind us that the great Swiss psychologist C.G. Jung,
Yes,
he's the one who also gave us the concept of the shadow that was mentioned earlier. But one of the things that he said was that he eventually came to realize that the vast majority of the patients who came in to consult him with various kinds of problems and symptoms and so on, were primarily struggling with spiritual issues. This is how Jung came to understand this, that fundamentally these psychiatric symptoms were actually rooted in a spiritual kind of crisis.
Well, you know,
Yeah.
I'm sorry.
Sorry, go ahead.
You talked about energy a lot earlier, and I completely agree with everything you said about energy. That's pretty much how I think of things when I'm trying to sense what's going on. And you can usually tell, like Debbie was saying earlier, you can definitely feel something that is extremely negative. I never could tell the difference between something that had been, in a body before or not. I didn't have that kind of distinction. But one thing I'm curious about, Doctor, is is it your contention that there is nothing else besides a person that has something psychologically wrong with them? I guess kind of what I'm asking is, have you ever seen a case where you thought maybe someone did have an entity, something that with intelligence that didn't belong in their body, or do you think that can pretty much be explained with psychological irregularities?
Well, that's really to the point, isn't it?
Yes, I guess it is.
My own personal perspective is that I don't believe in external entities. Okay, so my own personal perspective is that this phenomenon of the possession syndrome is primarily a psychological one, and that any so-called entity that's involved is a manifestation from within rather than from without.
I see. Okay.
Sorry, I have to leave you all. I have another engagement. Dr. Diamond, has been such a pleasure to speak with you. And
well, same here. I also have to go, so we're leaving at the same time.
Okay, guys, it's been awesome as always. I'll talk to you all soon.
Absolutely. We appreciate both of you guys joining us. Kelter, are you going to hang out, or do you need to bug out too?
I can hang out. I got time. It said till 3 p.m. my time, so I'm good till 3.
Okay, awesome. Thanks, Dr. Diamond. We appreciate you joining us.
It was
awesome. It was a great
Oh.
conversation. I appreciate that.
My pleasure. It was, there's a lot to talk about here, so we could probably talk for a lot longer on this subject. But I've got to go for today.
Awesome. All right. Thank you very much.
Okay. Bye now. Thank you.
Bye.
Thank you.
We all still here, I guess. A couple of
I'm
us are.
still here.
I was trying to think of how to phrase that properly with, I didn't want to just take ask him straight out, but I kind of did at the same time. So.
Well, yeah, you basically said, is this bullshit or is this not
exactly.
bullshit?
That's kind of what I was wanting to say, and I try to think of the best way to say it.
Yeah. Just a little more eloquently. This is such a tricky area, which is really why I wanted to get some experts together.
I actually wanted to bring up I know he only had an hour, which is why I was kind of holding back, but there is another academic component to it that I wanted to talk about, which was anthropology. Because anthropologists, they actually go to the cultures, they see exorcism rituals, and they see they see the spiritual component of it. And some of their articles are very interesting. There's been some that they're talking about it, and they're talking all scientific about the exorcism ritual and the observations, and then suddenly they'll make a comment like, and a black cloud was seen rising from the person, and you're going, huh, all right.
Yeah, that's kind of the point I was going to try to eventually drive at. I didn't realize we only had an hour. I thought we had a little longer. I was going to say, is it possible that there's both going on? Maybe there are some that are psychological only. Maybe there's some people that just think they're possessed, but maybe there really are some people that are possessed as well.
I actually think that some of the times I'll be working with a person, and it's like I know that me listening to them and validating certain things, I'm trying to get them to change their focus, because it's the energies, it's their energy patterns, or something will be removed from them, but they'll still be running those same patterns because they're so used to having them. So they'll almost like create a shadow of it. They'll basically create it with their mind. So in those situations, I shift towards, okay, now it's working with the energies. Now it's working with them, and to start changing those patterns, removing the energies, getting them also to work at changing their behaviors. It's usually baby steps, though, at that point. Like an actual removal of an entity, there's usually like an instantaneous relief. Whereas I find when it's the energies, working with the energies of their mind, it's a slower process to transition them.
Yeah, it's rewiring them versus, unplugging something that's trying to plug into their consciousness. Yeah, I've had on occasion, unfortunately, several occasions where I was in the presence of multiple folks in a psych ward, and from a shamanistic perspective, you could literally go down the line and sort of go, okay, this person feels crazy, this person feels fuck nuts crazy, and then this person is crazy, and there's something else in there with them.
Mm-hmm.
You know, and there is a very distinct difference between those three sort of scenarios, right? You absolutely know, in my experience anyway, I did, when you encounter somebody who has an entity attached and it's powerful enough that you feel those two separate beings.
And sometimes they cross. I know sometimes the entity will actually rewire the person's energy, so you get a double whammy going on there.
Yeah, I've never been in the presence of someone who was far enough along in the possession progression where the entity was in full-blown control. Not that I ever really think I want to be in that scenario, but it does strike me at that particular entity if the original host's personality and consciousness is completely suppressed at that point, would you only feel one person?
No, usually what happens is I see when I've had that happen. I've been attacked before, like actually physically attacked. And when that happens, what I saw was the person's eyes shifted. Like I saw two sets of eyes.
Okay. I've seen that.
But it was to the point that the other eye kind of dominated the person's eye. Like it wasn't like there was just two. It was like the eye took over, and I actually knew it was coming. I was like, I knew they were going to lunge at me before they lunged at me.
Have you seen any of the videos online that show something? It's just like what you're describing, but they're saying like these people are. It's usually like a president or something like that, or someone that's in politics high up, or someone who's well-known celebrity, and it'll show their eyes do what you just talked about. But they'll say under there that it's because they're an alien or something like that. But I'm wondering if you've seen those. Is that pretty much what it looks like, or have you not seen what I'm talking about?
I know what you're talking about. I have seen some of those videos. No, it's more of an energy shift.
Oh, okay.
And it's just how I see people. I see everybody, including their aura, most of the time. So I sometimes see the that shift that happens with the energy, with the takeover of the eye. It's really hard to explain. I'd have to. It's just kind of like their eye is there, but there's a double eye, almost in the same space, and then suddenly the other eye just becomes dominant.
Right. Yeah. And years ago, I was involved in a case on the northeast side of Houston, where there was a really, probably not demonic, but a real sort of asshat entity, who was trying to impress himself upon, and harass several people, but one person in particular, this guy's wife. And they got run out of the house, and because of this thing, it had a really neat trick where it could just outpour this sort of visceral, cloud-like fear that was just infectious. Mm-hmm. And you couldn't help but just, basically kind of crap your pants and go, I need to get the hell out of here. And the husband in the scenario just had enough. He knew what was going on, and he believed that there actually was an entity going on, involved in the case. And he decided he was just going to, as we were out in the front yard trying to figure out, okay, what do we do next? He decided he just had enough, and he was going to just charge into the house and confront this thing and basically say, come at me, bro. Oh. And that didn't turn out very well for him. Dear. Yeah, it essentially decided to do that and jumped. I felt it literally dive into him. And he kind of stood there for a good solid 3-4 minutes as there was some sort of internal struggle, or he was trying to process what, now there's two people in my head instead of just one. Yep. He came out and started talking to him, and you could literally feel this thing sort of, even non-mediums, people who weren't sensitive, could feel this thing sort of lashing around in him, and it would, without him touching you, you would feel it touch you. And then in the course of the conversation, I forgot what I said, but I said something that would that provoked it a little bit, and you could see literally his irises went vertical, just like a serpent's.
Yep.
And I kind of went, oh, wow, okay, I'm going to step back because you're a big dude. Yeah, I've seen that personally, and it's scary, but it's, in my mind, can that happen just from psychological stuff, or is that one of those things that that you can reserve and say, oh, this only happens for spiritual situations?
In that situation, I would say spiritual, just because of the fact, usually, yeah, that situation, even the one I was in, the person was incredibly healthy. And the second I got the entity out of them, they were fine again. It was like once it was removed, they went back to their normal life. So it's like that it imposes itself on the person. And then once it's removed, the person goes back to being functional and fine.
Right.
Those are spiritual things, because you got a healthy person, healthy family, then suddenly you've got an entity that's decided it's going to be malicious, it's going to be, nasty. And then once it's removed, everything kind of starts, obviously there'll be some trauma, and usually these things are, bad, but the really bad reactions go away. The really, it moves, it shifts back into a positive healing perspective. Yeah.
Keith, did you have something?
Well, I was just going to ask, the doctor said that he hadn't seen anybody's eye color change. And I was wondering, have you ever seen any of that in your work where someone's eye color actually changes?
I think I read the article that you read about that, because I've heard of eye color changing. I've heard of scars appearing on one personality.
Yes,
on the other. Yes. I have seen eye color change. I actually, my mentor could change his eye color on command. It was pretty cool.
The reason I brought that up is I was curious, because if eye color actually changes, that is, that's not something that's just personality related or something. That's some physical change. Yeah. So that would have to say something, something to the effect that something different's going on here than just personality issues.
Well, not necessarily, Keith. I mean, dial back, to be fair and to be unbiased, dial back all the way back to the placebo studies from holographic theory. And in particular, look at the guy with lymphatic cancer. His belief system completely ruled whether those tumors grew or shrank.
I guess that is what we're talking about here, is that fine line of where the difference occurs. Because
our minds are incredibly powerful, so we can actually create a variety of things that these entities can also create. So, I mean, to actually find a standard as to what's possession versus what is psychological, I think that it is a very gray area, and they do cross, because I think our minds are very capable of creating, like, this one thing, this guy, one of his sides had diabetes and the other side didn't. He manifested diabetes and then got rid of it, depending on which personality he was.
Wow.
I have heard of person having diabetes or something like that in one personality and not in the other, and stuttering under one personality and not another. So yeah, that is true.
Yeah. So the sheer power of our minds can also play a factor in this, and to determine, sometimes our mind is the most powerful thing. Sometimes our mind just can do that.
Yeah, and depending on whether you subscribe to holographic theory or not, I mean, all reality is extrapolated through the filter of the mind or consciousness.
Yes.
So, I mean, it literally, reality is a byproduct of consciousness.
Yes.
From that perspective.
Well, when you're looking from that perspective, all bets are pretty much off. I mean, it pretty much anything goes when it comes to a person controlling themselves in that manner.
Right. Yeah, it sort of occurs to me, though, in this baseline scenario we're talking about of crazy versus spiritual problem, the only way I can really think to make any attempt at a definitive answer, and not that you would get a definitive answer, but at least a legitimate attempt at a definitive answer, is to have both a psychologist, somebody trained in dealing with the psychology of the situation, and a sensitive.
Yeah.
Who can tell? That's really the only way I think you're going to be able to figure that out. A sensitive psychologist.
That actually is a very, 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 very good point. And it's funny because at my mom's work, they're actually talking about that, how to incorporate spirituality into the medical practice, because they say that when people have a spiritual path that they follow, it can assist with healing. It can help them to feel better. It can help them to overcome this in less time than it would take if they don't have that faith. So they're starting to actually look at the spiritual component of it and say, okay, maybe this isn't just all woo-woo and stuff. Maybe there is an actual element here, and how can we implement this spirituality into the practice of medicine to assist with healing?
Yeah, that's a very valuable tool. I mean, from a shamanic, I can't talk. From a shamanic aspect, it's very beneficial for you to be able to go to a client who believes in you, and as the practitioner, all they need to do is change their belief system. Mm-hmm. They have an incorrect belief system, so you manipulate them in a good way to their own benefit, and basically say, "Look, use these magic beans, mm-hmm. and everything is going to be okay." And as long as you can actually convince them that these magic beans are magic and that they're going to do what you say they're going to do, mm-hmm. that in and of itself is the catalyst to restructure their belief system, yeah. and the problem goes away. But it has nothing to do with the magic beans.
Yes, the placebo effect.
Yeah. Shaman's been using that for a long time.
There is one case that I did. It actually happened in my own house, which was awesome, to say the least. But what ended up happening was I brought in a sludge entity to study because I wanted to kind of look at it. It was an item that had a sludge attached to it, a very violent one, and I had it contained, and this person actually moved it out of its containment. And I started noticing that they started getting incredibly angry very fast. It wasn't possessing them, but it was playing on their anger. It was amplifying their anger, and they were actually getting to the point where it was getting like pretty dangerous. And then I kind of clued into what was going on, and I didn't tell them what I was going to do. I went upstairs and I set up, because of my path, I did an exorcism, but with using demons instead of the Catholic exorcism, because that's my path. So I set it up. I didn't tell them I was doing this, but they actually came into the room and started yelling at me and basically getting angry at me and trying to get me to stop. And I was like, no, go away, get out of here. So with them yelling at me, I managed to get the ritual completed. And then 10 minutes later, it all went away and everything was fine.
Isn't that wonderful?
Yep. 10 minutes later, after the ritual was completed, everything was fine.
I've thought about that several times. If you've got a negative entity that's actually attached to an item, whether it's in the best interest of the person who's being afflicted, if you just take that off their hands because you know how to deal with that sort of situation. But I don't really want a hot room in my house.
Oh, that's why I took it. It was bothering it was actually on I took it off another person and brought it home because I was kind of curious, and I knew I could contain it, but the person moved it. They actually took it out of the containment unit, and then I was like, oh shoot. And yeah.
Yeah, the Warrens had a room where they just stored stuff like that, and I wouldn't want to sleep next door to that.
Oh, me, I'd go in there and be like, yes, I want to experience all of this, but that's just me.
Yeah. I don't have enough medication to deal with that kind of crap. Okay, cool. I think we probably beat the horse to death enough at this point. We can probably wrap it up here, unless you guys have anything else you want to throw out.
No, it's a good conversation for sure. There's definitely a lot of gray areas in there, but I don't think you'd ever be done talking about it.
I think it's one of those things where it crosses. What I've noticed, humans, we seem to have this thing where we want to categorize and separate everything, but then those Absolutely. Separate paths don't end up communicating. They end up kind of just going their separate way and forming theories. But it's like we segregate ourselves. But what if we just kind of came together and communicated more? We'd see just how interlaced and overlapping everything is, and how even though we call something different, it is actually the same concept that we're talking about.
Yeah, science is especially guilty of that. It's very rare to find somebody who's multidisciplined in science, but those are the people who make the connections because they're not siloed anymore.
Yes.